Welcome to the City Current Show, powered by Higginbotham Insurance and Financial Services.
This show focuses on sharing good news and powering the good in our community. Now here's your host, City Current CEO, Jeremy Park.
Welcome back to the City Current Show, powered by Higginbotham. I'm your host, Jeremy Park. We're always honored to bring you inspiring stories of individuals and organizations making a difference and powering the good. And that's why we're so excited to have with us Tom Wills, Chief Administrative Officer with Baptist Heart Institute at Baptist Memorial Hospital, Memphis. How are you doing?
I'm great. Thanks, Jeremy, for the opportunity to work with City Current and put this information out for the community.
Absolutely. You all do tremendous good when you look at Baptist Memorial Healthcare, the system, been longtime charter partners with City Current, literally since the inception. So over 20 years of working together. And let's start with a little bit about Baptist Memorial Healthcare and Baptist Memorial Hospital. So give us an overview from your vantage point, and then we'll dive into pretty heavy around cardiovascular care.
Sure. For those that don't know, Baptist has 24 facilities across 3 states. We cover a large geography and large demographic of patients. So it's important for us to be involved in the community. So, our largest facility that does the biggest breadth of services is here in Memphis. And so, that just doesn't mean that we stay here. We have doctors that go out in the community and do a lot of good work for patients that can't get to us.
Let's go ahead and dive into your world. So when you talk about Baptist Heart Institute, talk about your vantage point.
The Institute is not necessarily brick and mortar. It's more of an organizational philosophy of how we tie the pieces together. We partner with our surgeons and our cardiologists and all the referring physicians of multiple specialties. Baptist Medical Group is a huge partner of ours. That's who employs our surgeons, and we work with Stern Cardiovascular for our cardiology and interventional cardiologists. And so by doing that, we tie our expertises all together. And so Baptist Memphis serves as a beyond tertiary referral center, quaternary referral center. We do a lot of the high risk surgeries that some of our other facilities may not do very frequent. So we try to bring those really high end cases here. And so we have everything from our office docs and our outpatient diagnostics all the way to our heart transplants.
Yeah, let's go ahead and dive into some of those, because I think some of this stuff flies under the radar when you look at all the good you're doing. And so that's the fun of this, is raising awareness and talking about all the good you're doing. Talk about the transplant side. I think this is something that's, when you look at the innovations around that and the surgeries and what that means, and, obviously then the ability literally to save lives. Talk about the heart transplants.
So the transplant program is kind of a twofold. So it's mechanical circulatory support, or MCS, is the artificial heart pumps. It's not the true artificial hearts as you might find online somewhere, which is great technology, and some facilities are starting to do it. But we do the full heart transplants from patients that have unfortunately passed away, and their loved ones, they've left their organs behind as a lot of good reasons to donate. So we're actually 40 years into our transplant program here at Baptist Memphis since 1985. We're going to be celebrating our, we actually had a heart-to-heart event where we had 9 heart transplant families meet their donor families, met the recipients, and they got to listen to their hearts. Which is really cool. It was not a dry eye in the room. We had in our Garrett Auditorium, which is great. But the transplant program, I think some of our donor transplants, there's multiple programs across the country, but the hearts are not as available as they have been. Either one, because some people may not want to donate, but others is the stroke care that's out there. The incidence of brain death is becoming less and less. So there's other ways that we're doing this, but a lot of our patients are benefiting from the LVADs, left ventricular assist devices that we do that gives that heart that extra push while they might be waiting for a transplant. But we've done anywhere from 30 transplants a year. And like I said about our incidence of brain death, our transplant volumes are still, they're still coming. It's just been a little smaller, but it's a full breadth. We have transplant surgeons, kidney doctor, nephrologists as our kidney doctors. We have pulmonologists. We even have patients see social workers and psychiatrists to make sure that they have the support and they're at the right headspace to know that they're ready to receive a heart. There's a lot that goes into it. It's just not a one and done thing.
Yeah, and I'm glad you mentioned that holistic approach. Tie that into some of the other innovations when you look at the cardiac care and some of the different things that have been, whether it's technology or just protocols, things that have advanced that really are truly saving lives. So talk about some of the other things
Yeah.
that your attention around cardiac care.
So there's a term called guideline directed medical therapy, GDMT, and that's really where we're taking all the science behind the healthcare and disease management, and we're trying to make sure that patients with heart failure, for example, there's a fourfold approach to the GDMTs for heart failure patients. So sometimes patients come to us and they might be on a diuretic and something else for blood pressure, but they're not fully maximized. So we're using science and technology to bring those medicines to the patients to make sure that we try to basically tune them up. It's like going to getting your 100,000-mile tune up is, you come in, you have an echo, you put you on certain medicines, and not everybody responds well. Some people do real well with very low doses, and other people we need to ratchet it up some. But so we have, disease management. We also are using AI technology, which is really cool. We've got a new AI technology. We're actually getting ready to do a trial with a company, and it's going to be finding incidental aortic valve calcium. So one of the biggest valves in your heart's the aortic valve, part of our structural heart program, then our TAVR program we do here. And so this technology might, if you had a CAT scan done, whatever reason, you have incidental aortic valve, but you never knew that you had it, the AI is going to help us filter through and find those patients and try to bring technology and identify them early in the disease process so we don't find them later when they've decompensated. So we're using AI, we're using science, we're using best practice, as you said, the multidisciplinary. So we're trying to tie as much as we can together to take that to the patient.
Talk about education, raising awareness around, what you eat, exercise, like taking care of your heart. So being proactive on that side. Talk about some of the educational things that you all are doing in the community, and then share some tips.
Yeah. So in the community, we actually have part of our chest pain center. They actually go out and teach hands-only CPR. We have some folks that we attend multiple health fairs around town, try to get as much face time with the communities. We have cardiac rehab where you learn they have cooking classes. You can learn how to do all of that and what's good, how to read a label on the back of a can. That's a real useful thing. And useful tips for, try to exercise, definitely make sure you see a doctor, and get your annual checkups. Don't go out there and try to run half marathon if you haven't seen a doctor. I mean, that's always fun. It's like, I'm going to go run a half marathon. All right, when's the last time you saw a doctor? So see your primary care physician. That's strong encouragement. Make sure you get your everybody loves those 50-year colonoscopies. Make sure you go get checked. The ladies in their mammography. I mean, it's all about preventative health. And you can self-refer to a cardiologist if you have family history. So it's really good just to stay involved with your healthcare provider. And there's such great nurse practitioners. I'd encourage people that might have hesitance to see a nurse practitioner. You can actually get in to see them a lot quicker than you can to see the main doctor, but just feel comforted that those NPs are all backed up by physicians. So no matter where they are, a doctor will see your record and review it, and the NP is just an extension of them. So I try to encourage everybody. That's what I do myself. I have no problem seeing an NP. So, just take care of yourselves and see your physician.
Carry that into the leadership piece of this, the communication internally with your team, like you were talking about before. So when you talk about communication, collaboration, that collaborative approach to being proactive with health for your team, and also just from a management standpoint, I know you have the military service background. Thank you for your service, but tying all these pieces from a leadership and a process standpoint together so that it is seamless and easy for the patients. Talk about kind of behind the scenes, some of the things that's going on for your team around communication, process, and leadership.
Sure. We try our best to engage with all of our leaders, at the nursing level, all the way to our physicians. And it's really important to try to break down the barriers that our physicians and our providers see. And it can be challenging sometimes, but most of it is about communication, just open, honest communication. We try to lead by example. We try to remove every barrier we can. We try to focus on patient and put the patient in the center, and make sure that all the decisions we do are trying to support our mission and make sure that we have great patient outcomes.
Share some success stories, some accolades that put a smile on your face. So what are the things that really put a smile on your face when you talk about the recognitions and the success stories?
So I think I can look towards a lot of our accreditations that the hospital has related to the cardiac program. We partner with the American College of Cardiology, and our cath labs, our EP labs are accredited. Our structural heart program is accredited. We have our chest pain is accredited. We have so many accolades and awards we've won for our heart failure program, from Get With Guidelines to the ACC, and our stroke program is awesome. So it's very rewarding to see that we have so many good processes in place, that there's places out there, and you get the little badge of honor, I guess. It's not like your Boy Scout merit badge, but they're kind of cool to see. And when you look at our website, is really neat, because we have them all displayed, and it's pretty impressive when you look at them all at the same time.
Yeah, and I think with each individual is a personal story, and the ability, like I said before, the ability to save lives is powerful. And so carry that into when you look at how the community can help, being proactive and getting your checkups, like you mentioned before. That's one way, but talk about how the community can help your efforts.
I guess try to make sure that you take care of yourself, and if there's a health fair around you, go get your blood pressure checked, go get your blood sugar checked, make sure that you don't have diabetes that's not been managed, because that diabetes is just, it's almost even worse than hereditary when it comes to what diabetes will do to your body. So know what's going on, know what your blood pressure is, take your medicine, do that for yourself. Just make sure that don't smoke, all those things that you see that some people just don't. There's lots of, if you have issues not getting access to your medicine, talk to the provider. There's lots of ways to get medicines these days through grant programs and so don't just say, I can't afford my medicine. So talk to your provider. There's lots of patient assistance programs that are out there that we can help get you your medicines.
Are there any certain warning signs or things that people need to be aware of in terms of fatigue, being tired more than normal, irregular heartbeats? I'm just trying to think, are there certain things that people just need to be aware of as warning signs?
Yeah, definitely. So severe short of breath is actually, if extreme fatigue, short of breath, inability to carry on your daily work or daily activities, if you can't go grocery shopping and sit there and have a conversation with somebody, walk across the parking lot, those are some symptoms of heart failure. Yeah, for the ladies out there, don't the traditional chest pain, heavy, my left arm hurts. That's a male diagnosis or symptom of chest pain. Ladies actually have very different. They might have middle of the back pain. They still might feel some tightness in the chest. Uh, so ladies are very different in how they present with their chest pain, non-traditional. Most of the studies that show the left arm chest pain, that goes back to research that was done a long time ago where those research participants were males. So that's where some of those symptomologies come from. But severe fatigue, swelling in your legs, generalized swelling, there's a lot of things that go into it. And so whether that's a valve disease, whether it's a heart pump failure issue, whether it's a lot of those have underlying disease processes that started those. So it's either you could be a diabetic if you have a lot of family history. It's real important to know your family history, and so when you see your doctor, make sure that you spill the beans. Don't withhold information, because it allows the doctor to make the best choice for you and help guide your care.
Absolutely. For you as CAO, give us one goal. So that can be personal, professional, but give us one goal. We're still fairly early in 2025. So when you look at 2025 and beyond, what's a goal?
The goal is we're continuing to grow our program. We're in the process of recruiting some more surgeons for our CV program. Really, the ultimate goal is save one more life, and it's one life at a time. And I get the pleasure of traveling around. I went to Jonesboro, Arkansas with Dr. Yarnoff, one of our heart failure specialists, and I got to meet one of his patients that benefited from some technology. It's called a barostim that we do. And this last deer season, she was out hunting on the lease with her husband. And 2 years ago, she was in a wheelchair and couldn't walk without severe short of breath. So, it's great to actually meet the patients where they live, and they live out in the boonies in Arkansas somewhere. But that's just one small example of what we do. But it's one life at a time. And I'm a nurse by training. 31 years ago. So, I try to put patient first and treat everybody like my parent, and what would I want them to have, or what would I want them to know?
Yeah. We'll wrap up with website, social media. Where do we go to learn more about the Baptist Heart Institute, Baptist Memorial Hospital, Memphis? Where do we go to learn more and connect in?
So we have a lot of resources. Baptist Memorial Healthcare System is pretty available across the internet. We have a lot of our services and how to connect with a provider located on our website. So you can find the doctor closest to you. And if you have any questions, there's contact numbers on there, and we're happy to direct your call and find you a provider that fits close to you, and maybe even fit one to you, what you like to see, whether it's male, female, old or young. We try to match the physician to the patient, and try to make it as comfortable as we can.
Well, an easy place to go and learn more is baptistonline.org. That's baptistonline.org. Tom Wills, thank you for all you and your amazing team do to power the good. Thank you for coming on the show.
Thank you very much. It's been a pleasure. I enjoyed it.
Higginbotham Insurance and Financial Services is proud to power the City Current Show. We're a people-first company that protects what matters most, the families, businesses, and trailblazers that keep our community going. As one of the nation's top independent insurance firms, Higginbotham is a single-source solution for business insurance, employee benefits, HR services, and personal insurance that's customized for you. We're here to serve you, the people you care about, and your community. Call 866-377-1959 or visit higginbotham.com.